According to the latest statistics from the Centers for Disease Control, 24% of the population has used 3 or more prescription drugs in the last 30 days. 12.8% have used 5 or more during the same period. Oftentimes, these drugs are prescribed by different doctors, which increases the opportunity for unintended adverse effects. The pharmacy department at UI Health has instituted wide-ranging medication management services, including comprehensive review of patients' drug therapies and the use of protocols to ensure the best outcomes for patients. Medication management services can include medication therapy management, comprehensive medication management, and disease state management, noted Dr. John Garofalo, Senior Associate Director of the Clinical Pharmacy Services at UI Health. Dr. Andy Donnelly, Director of Pharmacy Services at UI Health and Associate Dean for Clinical Affairs at the UIC College of Pharmacy, added, "The focus of all pharmacists practicing at the University of Illinois Hospital and clinics is to provide these services to our patients, and our number of clinical pharmacists and their scope of services really sets us apart from other hospitals. These pharmacists are on the front lines providing medication management services to patients and driving positive patient outcomes." One of the ways pharmacists are ensuring those outcomes is through medication-related clinical care protocols. The protocols define appropriate care and treatment of patients and allow pharmacists to initiate orders to provide timely care and services for specific patients. Protocols not only allow pharmacists to initiate new medications and change doses of current medications, but also to order labs, consults, and imaging studies as needed. Complementing protocols are unique programs like RX Cares, the Mobile Pharmacy Education Program, or MOPHE, and the UI Team RX. RX Cares uses student pharmacists under the direction of a clinical pharmacist to review patient medications upon admission and before discharge to determine if the drug regimens patients are prescribed are therapeutically safe and sound. MOPHE is also run by student pharmacists under the direction of a clinical pharmacist. They wheel a cart containing educational materials to patients' rooms prior to discharge and educate them on several targeted medications and disease states, focusing on appropriate injection and inhaler techniques and general information on diabetes and anticoagulation. They soon will be providing tobacco cessation counseling as well. And the UI Team RX is a pharmacy coordination of care program run in 6 of our outpatient pharmacies for patients with hypertension, hyperlipidemia, and diabetes. Undergirding the entire system is the hospital's new electronic health record, commonly referred to as an EHR. In late 2020, the hospital transitioned to Epic for its EHR needs. The report-generating capability of Epic allows pharmacists to run a variety of patient-centric reports themselves. Using the various new reports and dashboards will allow issues to be identified before reaching the patient. Standardizing practices, pharmacist oversight, and democratizing information have allowed UI Health's pharmacists to provide exceptional care to their patients in the hospital, in the clinics, as well as in the outpatient pharmacy setting. That is the future of pharmacy service.